Well, perhaps you've had to cancel some plans this holiday season. Family members call and say, just tested positive, got the flu, got the cold. Well, Merritt Bates Thomas is back with us to talk about where we are right now as we look into the new year. So it's good to see you.
Good to see you.
So how are we doing in the tri-state area?
Well, we reported out a slight increase. I forget the exact number, but just maybe a 1 or 2% increase in the number of cases of COVID-19 over last week. Doesn't seem significant when people look at the smaller numbers, but the roller coaster ride continues. I think we're getting better at riding the roller coaster. We're more used to, I think, the pitfalls of it, what it entails, and using good judgment around scheduling family events or curtailing them or canceling them if need be, unfortunately.
Right, because you get, if your house, no matter what size it is, you get 20, 30 people together.
Right.
And you can't open the windows. I mean, it's 6 below. So
exactly.
Not like being able to be outside.
Right. We've got a great infographic, though, that just shows people, number one thing, the common denominator with any of these viruses is, if you're sick, stay home. Use good judgment. Don't infect anyone else other than those that may have already been infected within your household or that you've had close contact with. The incubation period on all of these, whether we're talking COVID-19, norovirus, which has been circulating, the flu, the incubation period is really relatively short for most. It can be a little bit longer for COVID, but it's become shorter. There's an infographic we shared that just kind of shows what the symptomology looks like too, so that it's not that we want you to be your own doctor, but it can kind of guide you to make some decisions around contacting your healthcare provider, getting tested. You know, home testing for COVID-19 is readily available. It's so important that we take the measures we need to keep ourselves healthier and to keep those around us or those we could infect safer and healthy.
How can we see that graphic? On Green River District? Okay.
Yes, we sent it. I believe they put it up on the screen for us while we were talking through it. But I sent it in, so you can post it on your website if you'd like.
And there we'll
post it on our website. We've shared it on our Facebook page, and we'll continue to push it out because it guides people to make the choices or the informed decisions around reporting to their health care provider around their symptoms and getting tested appropriately.
Now, what are you seeing as far as flu infections and also RSV and other adult respiratory issues?
Well, most people have reported this is the worst flu season in close to a decade, I believe maybe 10 years. Wow. And it's really hit the healthcare system hard. It's hit healthcare providers hard in terms of the volume of patients they're seeing. Number one, if you can get vaccinated for both the flu and for COVID-19, make sure your boosters are up to date. Make sure you're vaccinated. It's so important you take those steps. And infants at the age of 6 months older can be vaccinated for both flu and COVID-19. So it's important that the entire family be vaccinated. And of course, as people age, it's more likely that what they develop will be more severe. So it's important, and if you're immunocompromised in any way, that just increases the likelihood that the effects can be more severe for you as well.
All right, well, get those vaccines. They're out there. Get your home test.
And continue to take good measures. You know, keep your hands washed, wear a mask in crowded places, and keep distance. Those are things we learned. There's still good measures that work, and it's not bad that we practice them as we move forward.
Keep up the good work, folks. Thanks, Merritt. Happy New Year.
Thank you. You too.
More lifestyles for you right after this. Stay with us.